Hey, and welcome back to CTLA4 Chronicles. Um, I wanted to talk a little bit today about something that's like medical gaslighting, but instead of it coming from like healthcare providers or in a healthcare setting, it happens with family and friends and sometimes even strangers, which is crazy. But I've talked to some other people who also have CTLA4 and have dealt with like family not believing that they're as sick as they are, or thinking that they're making things up or making things out to be worse than they actually are, even though like they're not the ones talking to the doctors, they're not the ones going to the appointments. And like that can get incredibly frustrating, especially when you rely on these people as like a support system or what you would have assumed would be a support system. That gets tough, especially when you're also dealing with medical gaslighting in the medical setting. We've dealt with this. I remember when Catalina was first sick, like not only were we getting pushback from doctors and stuff that like, oh, if you don't look for a fever, then you won't find one. That's crazy. Or when she was in liver failure and they told me that she just had a GI bug that she was having a hard time getting over. And like, had I listened to them and I stopped fighting for answers or anything else, I wouldn't have my 6-year-old daughter today. And like, same thing for myself with going through everything that I've been through. Um, Having family say that like they didn't think that our daughter was as sick as she was, and like, oh, it's always something, oh, she's always sick, like maybe you should stop bringing her to the doctor and all these things wouldn't be happening. Or when I was going to the doctor all the time, like, stop looking for things. If you're not testing for it and not finding it, like, just let it go. um, or this one's hard to talk about, being post transplant and having people think that I'm not as sick as I should be, which is like incredibly frustrating because I'm still on all of the immunosuppressive meds. I'm on steroids. I now have like a moon face. I had lost so much weight and I've put all of it back on, and like my body is not my body. I'm postmenopausal at 31. The maintenance of just being on hormones and having to make sure that I'm changing my patch and I'm doing this and I'm doing that on top of the massive amount of meds that I have to take every day. And the fact that like I can't do anything about what happens with being on steroids for a long period of time. And having people assume that because I do my makeup and I wear wigs and I make silly videos that I'm like super healthy all of a sudden. Like, was a transplant even really that bad? Like, I almost died. I almost died before transplant. I almost died during transplant, and I've almost died post transplant. I am not out of the woods. I basically live on house arrest because I can't actually go anywhere. I can do stuff outside, but like I can't really go in places. I can't eat inside. I can't, take my kids to indoor places. I can't take them to birthday parties. I can't really take them to doctor's appointments unless I absolutely have to and it's an emergency. And even then, I can't go into the emergency room with them when I have emergencies. Going into an emergency room around here could lead to me getting sick and dying. So I choose to wait at home and see if I can get better on my own, which has been dangerous. And I kind of talked about doing extreme things in our last podcast episode, when you become desperate. And then it leads me to having to either be driven or drive myself 2 hours up to Boston to Dana-Farber to see my doctors up there, because I know the environment up there is not going to put me in the same risk factors as some of these hospitals down here. With that being said, I don't have to explain, and I shouldn't have to explain all of that every time I get sick or every time something happens. But the way, medical gaslighting goes with families and stuff is, at least in my case, um, if it is not laid out and it isn't exactly how other people perceive it, then there's going to be judgment. And like, I have a hard time understanding that. And even getting like attacked on social media, and when I don't wear a wig and I like post videos and stuff and like voiceovers or whatever, and I have people commenting like, oh, are you a man or a woman? And like, come on. I don't know many people that attack somebody after having cancer or after going through chemo or a bone marrow transplant and like saying things about the way they look because of like what's happened to their body due to those extreme illnesses and treatments. Like, shame on you. And man, it's just hard to wrap my brain around. And this, I don't feel like is talked about enough, because you put something out there like this, and I'm sure I'm going to get hate for it. I'm sure I'm going to get hate from family. I'm probably going to get hate from friends. And I know I'm going to get hate from, people I don't even know. And it's like, the fact that I'm alive and here and making this video right now is a blessing, because there was a huge chance I wouldn't make it through this. They wouldn't even give me statistics on what my odds looked like going into transplant and surviving it. And like, I had doctors try to talk me out of the transplant, because they said, one, it's life-changing. It'll change your life forever. And it does. It changes you emotionally, it changes you physically, and it changes you mentally. And you are not the same person that you were before transplant. And like, that's just the nature of the beast, and it is what it is. But I would rather be the person I am today and be here and be able to talk about these things and share my testimony, and then be able to help other people who are going through this and are struggling. And so maybe they don't have to struggle the same way we did and the same way we do, because we can help them. And I would rather do that and be who I am today than be who I was or be in the grave because of other people's judgment and other people's opinion. Like, blows my mind. Open your mind. Have a little bit of perspective. Like, just because you know somebody who went through a bone marrow transplant, and maybe they had cancer beforehand, and like going through chemo for months and months and months before going through a transplant is a lot harder on the body than what I did. And like, my transplant wasn't easy. It was the worst thing I've literally ever experienced. But it's still not the same. I didn't have months and months and months of chemo. I had myeloablative chemo and radiation before my transplant. And the fact that I'm as healthy as I am is being celebrated by my doctors, but being put down by family and friends. And like, I struggle with that. So here's my rant. If you are in a similar boat, I would love to hear about it, because you're not alone, and it should be talked about, because people need to understand, like, if you're not the one going to the appointments, if you're not the one that's listening to the doctors tell you what you can and cannot do, what the rules are, how good you're doing, or how maybe you need to change things. Like my last appointment, they told me that I was stressing my bone marrow, so I needed to slow down a little bit. And even though I feel great for the most part, my bone marrow is pushing out red blood cells twice as fast as a normal person. And I'm still not making enough red blood cells, and I'm still not making enough hemoglobin. So I had to dial back what I was doing. And I'm not hiking like I was. I'm not going out paddleboarding like I was. I'm not, starting or continuing to work out the way I was, because they asked me to step it back a little bit. But they're also incredibly proud of where I am. And that says more. Like, the fact that these people came into my life and changed my life and saved my life, and they give me more support than I have in my own family, it's almost outrageous. But it is what it is, I guess.